Hello, good evening, everybody. Welcome once again to our Public Health Forum discussion. My name is Parth. I'll be moderating today's session again. And for those of you who are joining Nivarna for the first time, Nivarna is a public health platform which was founded last year. We completed 1 year a few days ago. And the main aim of this platform is to make public health information more understandable and accessible so that we can make public health a part of our daily conversations. And with that, we hope to bring a change in this community with regards to public health. And today we are going to talk about disasters in India. I'm sure a lot of us have been reading a lot of news, especially since COVID hit us. The disasters have taken a huge focus in our media. With the recent Odisha train disaster, things came to light, and a lot of us realized that as a country, we're not really prepared to face any sort of disaster. And so today's forum, we are now discussing what can be done differently, what is being done when it comes to disasters in India, and we'll be listening from different stakeholders. We have Dr. Priyadarsh with us today, who is a community medicine physician. He has played a significant role in various disasters in the country, and most recently in the Manipur health camps, which is itself a disaster conflict situation. We have Dr. Sonali with us, who is a public health expert who has been advocating for better disaster care for some time now. Now we have Dr. Ramesh with us, who is an ex-IAS. Sir has worked with the Andhra Pradesh government, and his role as an administrator will give us help us in understanding what the role government should play when it comes to disasters. And we have Dr. Gina, who is an emergency medicine consultant from CMC Vellore, one of the busiest emergencies in the country. So what role do these people play? They'll be talking about the role of community, the role of volunteers, the role of hospitals and government. So I would like to hand it over to Dr. Priyadarsh now, because the first and foremost is the first responders, which is usually the volunteers. So what is the role of volunteers when it comes to disaster management in India? Over to you, Dr. Priyadarsh. You're on mute, sir.
Yeah. So thank you, Parth. I will just share the screen. Uh, yeah, is it visible?
Yes, sir, it is visible.
Okay. Yeah. So yes. So I'm Priyadarsh. I did my MBBS and then community medicine from MJMS Sevagram, and did some more courses, and also out of curiosity did counseling and family therapy MSc. I worked in various disasters. I started when I was an intern in Bihar, Kosi floods. I ran away from my college and worked there for 3 months. I got extension in the internship, but okay, fine. Worked in the Kedarnath tragedy in 2013, Kerala floods in 2018. In between, there was Kashmir floods and other things. So I just helped mobilize volunteers. In Assam floods last year, Andhra Pradesh flood in Allu Sitaramaraju districts, and this year in Manipur Valleys, we went there, and then this was the first conflict area I went. Before that, it was all disasters and not so much challenging, but Manipur is a lot other challenge. Yeah, some photographs of like how we worked with ITBP or then rappelling in Kedarnath floods or in Kerala floods going to the boats. So the most challenging one was in Kedarnath where like everything was destroyed, roads were not there, so we have to like daily do rappelling or climb the mountain, do trekking and reach the various places. And this one is recent last year's in Andhra and Assam. So yeah, so I just wanted to talk about role. What is the role of volunteers? So they are the person who are the first responders, so they can help in search and rescue. The local volunteers. Also, the army comes in mostly in the floods and they help mostly in the evacuation. The army helps. But the emergency response is by the local volunteers. They also help in communication and spreading information, which is very important. That where there is more danger, where to move, which are the safe passages. So generally, this all things are done by the local volunteers. If they are trained, and also the elderly in the disaster area, they provide a lot of psychological support, also rehabilitation and recovery. They also do a lot of damage assessment, community outreach, and coordination, and they reach out to the needy who need them most. And if they are trained, or if the people like us go to some disaster sites, because we also are volunteers, so then we can also give the professional help. Right now, Miss, we are sending volunteers as psychiatrist or psychologist. We're sending educational specialists to Manipur right now. So they are going to help the students who are now drop out from the schools to develop some local educational material and start so that their this year is not mm, uh, they don't waste this year. Already due to COVID, 2 years are wasted on education. We're also training the local volunteers about how to identify the basic sign and symptoms, danger signs of psychological morbidities, so that if anybody is having some self-harm thoughts or in depression, they can just catch those signs and inform the psychologist or psychiatrist for the further management. Also, we're training the people in Kuki area and Meitei area uh, about first aid and basic medications. These are the local volunteers in the relief camp. Some people who are in graduation or 12th pass people, but because they are in relief camp, which is a very far away from the hospitals, if we train them, they can give the first aid or basic medicines for fever, cough, cold, and do's and don'ts if they know, and then they can help in this work. So they are the first responders, and they are very much needed. But also various volunteers from outside goes to disaster site, and their role is also very much crucial and important. But everything cannot be put on volunteers because they cannot do professional duties because they lack a proper training of how to cater this disaster response. They lack experience, so they will have goodwill, but if they don't have enough experience, often they will do the superficial measures, but the uh, deep impactful thing are not seen while working in the field. If volunteers are working on their own, there is a lack of coordination between different volunteers who might be working for different things, but there is no coordination in between. And this happens with also the government and NGO agencies. There is a lack of coordination among them. Uh, I just seen that in Kerala floods there was so nice coordination because everything was going through the collector, district collector, magistrate, and everybody was registered with them. So everybody was knowing that who are the stakeholder in different domains, in education, in ration, in food supply, vaccination, medicine, so that there was no duplication of work. But in most of the other areas, this understanding is lacking. So there is a lack of coordination also. Volunteers generally don't know which are the hazardous environment, and then they might end up in danger in medical procedures and various other things. They are not trained, so or not licensed. So it is also not possible through the volunteers. The technical and specialized tasks are various during a disaster, like making makeshift homes or makeshift toilets, or uh, cleaning the water which they are using for drinking purpose, or planning the nutritious diet. So these are the very specialized and technical things, but we cannot just depend on volunteers for this, but would need some training of them, or either a technical person who will help them. We cannot independently deploy the volunteers for any work. We have to send them through some agency or through some government people or NGO or with the army. and then with them they can work. We cannot deploy them alone. And yes, when we do volunteering, we all know that there is inconsistent availability of the volunteers. So one volunteer comes forward for like 1 month, commit for 1 month. There may be some reasons that that person has to back away, and then like within a week or 2 weeks, that person is gone. So our whole planning is at a standstill. So there is a lot of uncertainty and inconsistent availability when we work with volunteers. And yes, there is limited resources with the volunteers. So they are not so much resourceful. Like government agencies or NGOs are much more resourceful with their full resources on specific domains. But volunteers have their limitations in that. So, considering the disaster scenario, these are the drawbacks. Like we cannot completely rely on them, but because they are first responder, very much near to them, they are mobile, a lot more flexible. If we can follow few methods, it will be very, very helpful. So, what are those? So we can do volunteer training properly. So like we do a lot of youth camps like in Chhattisgarh and Guwahati, Assam. So we are in process of training volunteers in different domains like health, psychological well-being, then recreational activities for the children who are suffering from disaster, or trauma counseling, taking care of pregnant women, taking care of elderly, and all those things. So if we have such 4 or 5 batches in next 4 or 5 years, these are very trained people who can be deployed anywhere in any disaster situation or conflict situation, and they can actually function as far as any trained professional. uh, there is very much second is the importance of volunteer coordination. So many people responds to various disasters in their capacity, be it volunteer personal, on a personal front, or from other domains like which we said education. uh, Ration kits are sent, clothes are sent, sanitary pads are sent, people will send blankets and other things, medicines, but there is no proper coordination between this. So the relief camp people don't know how much medicines they need, which medicines they need, how much supply of food, different type of foods is needed for a month long, and there is a lot of ambiguity. So people will just come and then donate according to their thought process, but it might be not the need of the camp. The camp's need might be something different. So this, and there is there is a lot of lack of coordination between the volunteers and also the different agencies. So if we can train volunteers to coordinate whenever they go to a field in one district, suppose, or in a one block, and they know that okay, what exactly things are needed in wholesome, and they can coordinate with other peoples, other NGOs, and license with the government agencies, then a lot of coordinated works can be done and duplication can be avoided. And there should be clear communication channels, because we don't know through which channel which things are going. If we give these things to this place, where it will go. So clear communication channels, if they are established in the initial phases of disaster, it helps a lot in setting a system where we can help the needy, and the help will actually go to the place where it should actually be going. Uh, there is very during the disaster we find that there is no proper task assignment or supervision to the volunteers, because people are not aware uh, properly about what the volunteers is supposed to do. Like you will say okay, go to that camp and see and just report to me, but that person don't have a proper reporting sheet, or the person is not knowing what he or she is supposed to see or observe. That person is not trained in observation. So these things happen. So again we have to train them properly, and also have a supervision, and few times go with them, help them observe, talk with them, and then we can assign them separate tasks. But during the disaster, everybody is a manager sort of person, but then they don't have the necessary skills, so there is often mismanagement. There is a lot of existing response going on, so we can integrate the volunteers with the existing response. And also we can offer volunteer support service, because then if volunteer goes to very traumatic area and come back, the person itself is traumatized. So we need to de-traumatize that person, offer them some counseling if they feel that there's a need. If they're drained out, we need to support them. And also recognition and appreciation is very much important, because a lot of people go to help with a goodwill, but after coming back, like they are not properly recognized, or they are not properly appreciated for their work. So this is also important, because if this is done, there is a high chance that in next disasters they are already experienced, so they will come with a new vigor, and they will help the people. We were working with different volunteers since last 15 years, and we were thinking about that why people go to disasters. So various different reasons came when we asked the volunteers why they came. So for some people it was thrill. For me it was definitely thrill when I went in 2008 in Kosi. I didn't know anything. In my second year of MBBS, I enrolled for disaster relief work in tsunami. But I was in second year, so the people like outrightly rejected me. Some people that you are in just second year, what you will do? But that was thrill. In Kedarnath also, it was thrill, adventure, and I was like, "Hey, I have to go. I will go travel and reach people, save them." So these are all the very fantasy ideas when we actually start working in disasters. But then slowly and slowly you start understanding that it is not your uh, pleasure that you are working for. You want thrill, so you will go to any difficult areas and just give some medications for one day, for 1 hour, and then return back. So what will happen after that one day? Next day, if somebody falls ill, who is going to take care of it? So then slowly I understood that no, it is not just about my thrill and adventure and my pleasure, but it is also about what systems I set in, so that for the duration of disaster, some system is set so that the person can get proper medical help at that village, even when I'm not. So then right now, then last 4 years, we're working on that, how to set systems where the most needy people who are in need of health, and at least I'm a doctor, so I'm also mostly concerned with the health needs, mental health and physical health. So how we can set the system so that they get the proper attention, and not for just one day, but for a continuation during the disaster period. So yeah, few people who are living close by to the affected community, they will go. Some people go with the humanitarian angle that they want to help. Uh, some people will go for the research work. I have also seen these people who come for disaster relief work, but they don't want to do some research work. Some people will go for CV building, because yeah, when you work with in such areas, then you have a very high chance to get good CV and good scholarships in outside India. Some really want to understand what's going on at the ground level, and also want to understand the situation there and how they can help. And some are really pure hearted, and they just want to reduce the suffering of people, and they just walk into the disaster area and then try to help in any way possible to reduce the suffering. So these are the different things. There might be more things, but we could just capture these things while talking with the volunteers who come with us during the disaster work. So we generally take young students, medical students, non-medical students to the disaster places, and try to see their strengths and use them for the benefit of the people to decrease their suffering. So I'm very much I very much advocate the youngsters volunteering in disasters. Like I have taken a lot of medical and non-medical students from different colleges across India to different disaster sites, and they love that experience. Love that experience. They learn a lot. They become more sensitive to the needs of the society. They little bit understand the complex dynamic of public health. They can see, okay, what are the things we have to look forward while responding to this disaster. Slowly and slowly, just initially humanitarian response like giving ration and medicines and doing health camps. But then once they understand the situation, they slowly move from the superficial management to deep impactful response where they are thinking about making systems and also training the local communities where disaster is repeatedly occurring, so that they become empowered, and next time if disaster comes they have the system to manage their issues. So I can see that change in myself also, and I can see that change, paradigm change, shift in various people. Yeah, and the people then understand the causes of disasters and also diseases related to it. Understand how to work effectively along with the group, along with the non-government organization, also with the government and with the community, and they get a lot of contacts, meet a lot of like-minded people like them at the disaster field. And I know my friends, I have like 50 friends from my first disaster and they're still my friend. So the friendship in disasters, I think, last much longer than we think. Or those friendships in non-disaster period, I think they don't last that long. So yes, in each disaster, I met a lot of friends, meet various people who are working at the ground or doing advocacy or raising funds for it. So we could roam through all these things, like right from fundraising to responding to advocating to making PIL, sending videos. So a lot of learning is there. So yeah, I'm still interested in more youth joining this volunteering during disasters, and there are a lot of experiences to share. But I think I have taken enough time. So during the question answers time or other time, we can talk more about it. Yes, Parth.
Thank you, Dr. Priyadarsh. That was a lovely presentation. You have very concisely told about starting from the role to limitations to what can be done to improve the volunteer participation. If I just have one question to ask you, you have seen a lot of disasters, over the past more than around 2 decades, almost 2 decades. Have you seen any shift uh, over the years? Are we doing better now, or have we improved when it comes to disaster management? Because mostly what you guys noticed was in your presentation, you have seen a lot of floods. So when it comes to response to floods, have you noticed any change?
It depends on the state. I think in the Orissa, they have very good mechanism. Also, after 2018 floods, Kerala has that mechanism in place, but not in the other parts of the country. They're still not organized. Still, there is haphazard decisions, and everybody's on their own, or they have accepted the fate. The people accepted the fate that yeah, it is occurring each year, and then we have to live with it. So there is no capacity building of the people or some systems in place. But in few states, I must have admit that in coastal areas of Andhra, Orissa, they are prepared very nicely. Also in the Kerala, but then a lot of things can be done. That's why it's a big opportunity for us. I'm not thinking it as a thing which is like, okay, this is not happening. I'm thinking it as an opportunity that yes, we youths and other people, volunteers, and all the stakeholders can fill this gap and can make it possible.
Thank you, sir. So now, coming to you, Dr. Sonali. Volunteers come and respond to the disaster, and once it settles, it becomes the role of the community to hold the government sort of responsible and accountable. Over to you to talk about the role of the community now.
Thank you, Dr. Priyadarsh. So, just a disclaimer: I'm not an expert on disasters. Most of what I'm going to talk about, the framing, I was fortunate enough to attend a course in South Korea last year, very short. It was a 10-day program on disaster studies, which also made me realize how multidisciplinary this field is. We had everybody from public health, anthropologists to activists to artists and sculptors. So it was a very multidisciplinary program, and which is also the nature of disasters. And community has various interpretations, and some of it may overlap with volunteers. So I haven't defined it clearly for this, so I've used a loose definitions as those who are affected by the disaster. Okay. Before I begin, I would like all of us, either in our minds or to type it down in chat, that would be interesting. Think of a disaster that is tied to your memory or to your family's memory. And I'll wait for 1 or 2 responses in chat. You can just name the disaster, or if you want a longer entry, you can type that. Yes, COVID is something we can all relate to, but it would be nice if we can think beyond that also. Uttarakhand floods, yeah. So, Sita says patient suicide. Seven says Kerala floods, family was trapped in the first floor. Devi says Amphan 2020, Kerala 2018. We'll all have stories. My Nani said she was born when some earthquake happened. Like disasters become like these hooks for our lived memories. What comes to my mind is something my dad talked about. He doesn't reminisce much. He's 80 years old now. And he was posted in Uttarakhand in the 1980s. And one of the things he did without decathlon, he went in a coat to the Gangotri Glacier, a trek. And one of the things he says when he reflects on this is that the world woke up too late to global warming. When I trekked there so many years ago, the glacier had already receded so many miles. There was only dust and bare earth in its place. So he never actually made it to the actual glacier. He did get frostbite. So, so we do wake up too late to disasters. And normally when we think of disasters, these are the images that come to mind. I'm sure we can all remember, we know what's on the right. Can anybody recognize the disaster on the left? Not too long ago, 2020. Anyone? Not lockdown, not India. The Lebanon incident, yes, Monojit. This was the storage facility which had some ammonium nitrate, I think, and the Beirut blast, which we all know about. So these are the kinds of incidents that come to mind when we think about disaster. And Professor Scott Knowles, whose program I attended, he talks about slow disasters. Poverty is the slowest disaster. When we talk about disasters, we are talking about poverty. If we aren't, then we are just chasing storms. So a way to think about it is you have a background of slow disasters, of inequity, of poverty, of malnutrition, and then they get overlapped with a fast disaster, sudden occurrence, an earthquake, flooding, and who gets affected more. So the disaster, which is the fallout of a hazard plus vulnerabilities in our system, it is people who are more vulnerable who get affected. And, I've put this picture there of multiple patients on a bed as an illustration of a slow disaster in relation to our health facilities and our health system. So one of the things we like to talk about, especially nowadays in the age of AI and ChatGPT, we talk a lot about innovation. But if you look at it, most disasters are disasters of maintenance. And if you look at Balasore, maintenance. If you look at Beirut, maintenance. There were lacunae maintenance. And maintenance is not glamorous. If it works, we don't notice it. If it doesn't work, there is a disaster. I've already mentioned inequity. If we look at any kind of disaster, we look at it happening in two different places. The impact on people will vary widely depending on where the place is on in terms of development, in terms of who is getting affected. In 2012, I think I was in Uganda for some field work, and I was just casually told, don't go to such and such a district because there's an Ebola outbreak there. It didn't go international. It was controlled. And within a few weeks, it was not an issue, versus what happened in Sierra Leone and other countries in West Africa. So even a certain, not a very great differential in the development status can really affect how, what is the impact of a disaster. You know, we can think more closer to home, who is getting affected by heat strokes. It's not us sitting in our air-conditioned rooms. This is something I've started feeling quite strongly about. We often see in media, and we ourselves may also use the term natural disaster. Flooding is natural, earthquakes are natural, volcanic eruptions are natural. But the natural part is just the hazard. The impact on people, society, environment is not natural. The disaster that happens is due to something we have done, we have caused harm, or something we have not done. And by we, the onus lies with those who have more responsibility. So governments. We need to not use the term natural disaster. So the Korea program I mentioned was framed around memory of this major disaster that happened in South Korea in 2014. So don't confuse Seoul with Seoul. So Seoul, it's not about the capital city. The name of the ferry that sank was SEWOL. And just like the Balasore incident captured the whole country's attention, this was an incident in South Korea which captured the whole nation's attention. And it was particularly tragic because this ferry that sank was taking school children on a holiday trip. And around 250 students from middle school died in this sinking. The reason I mention this is because what happened in the aftermath of this incident was really striking. How the family members, if we think of them as the community of affected people, the parents, how they came together and responded to this incident. Till today, they have not backed off. There's a third or fourth inquiry commission going on because of pressure from the affected families. And there have been, legal people have been arrested, have been imprisoned, who have been held responsible for the crisis. I'm going to play a video because that is more impactful than anything I will narrate. So the family members, the parents, what they did was they preserved the classrooms of the children who were affected in this disaster. So they took everything, because they were not allowed to preserve the classrooms in the school itself. They took everything from that classroom, exactly how it is, tables, chairs, light fixtures, fans, everything, and they recreated it in another building. And that now serves as a memorial. And I got a chance to visit this, and the people who take you around the memorial are actually mothers of children who died in the incident. And I'm going to now share a video of this. Let's see if I managed to do it. So the reason I'm sharing this is about memorialization in the aftermath of a disaster.
이 참사를 겪었다는 것이 무엇을 의미하는지를 그야말로 어떤 말로 표현할 수 없지만 어떤 몸으로 그 기운을 느낄 수 있었던 그러한 어떤 공간이었다는 거죠.
많은 분들께 기획교실을 안내하는 것이 우리 아이들의 진상규명에 함께 가는 길, 걸어가는 길이라고 생각해요.
기획교실은 생명의 전환성,
3명이라고 지금 생각을 하고 있습니다.
지금 인천에서 출발해서 제주를 향하던 이 세월호가
우리도 안산의 단원고등학교 2학년 학생 교실은 지금까지 기억교실이라는 이름으로 보존되어 왔습니다.
그런 기억 교실이 아쉬움을 남기고 곧 단원고를 떠납니다.
하지만 유가족들과 일부 시민단체는 교실 보존을 원하고 있는 상황입니다.
안산 단원고의 중치교실은 재학생들의 수업 공간으로 정상화로 합의가 됐습니다.
단원고 학생들을 위해서 우리가 나와준 거잖아요. 그래서 우리 부모들이 부족한 한계, 그리고 교실에서 나올 수밖에 없었던 것도 저희들의 한계점인 것 같아요.
거기서 우리가 그 참사의 슬픔을 더욱더 어떤 대비되게 느낄 수 있었던 공간이었다고 생각을 하는데 이 공간을 결국은 우리 한국 사회는 보존을 할 수
이제 나중에는 학생들이 와도 웃으면서 반갑게 이렇게 텍스트, 콘셉트 모든 하나하나 기록물을 다 기록 목록을 만들어 놓고요. 또 철관한 가지고 다 기록을 하고 그리고 그 기록한 것으로 이 공간을 복원을 한 거거든요.
전시와 이제 보존을 병행해야 되는 게 가장 큰 숙제이거든요. 단원고 기억교실 같은 경우에는 들어와서 많이 지금 모든 것들을 다 할 수 있게끔 지금 그런 방향으로 정책을 정했기 때문에
그리고 이 교실에서 아이들이 단지 공부만 한 것들이 아니라 미래를 준비하기 위한 국민들도 있고 또 더 중요한
So it was quite remarkable for me to see the extent to which they had memorialized a disaster and how active the community was even almost 8 years later. In contrast to, literally very little or no memorialization of the recent COVID disaster in India and in other places. So when we think about communities, it's not, relief work is important, but communities also play an important role in bearing witness, memorializing, and pushing for accountability. So there were community efforts or volunteer efforts during COVID to even count things like lockdown deaths. I will skip this because Dr. Priyadarsh has already covered. What I do feel is that efforts which have pre-existing trust networks, they get mobilized faster, or where there is some commonality. It's harder to mobilize disconnected networks right in the wake of a disaster. So the groundwork for crisis is laid when there is no crisis. What Dr. Priyadarsh talked about, training volunteers in advance so that they can be mobilized. There's a concept of disaster justice, which talks about the purpose of government and its responsibility to protect its citizens. And so disaster justice gives us the agency to demand and lay a moral claim on governance when governments fail to protect citizens. And this was a repeated thing that kept coming when we were talking with the people studying the Seoul ferry disaster or the families themselves, the idea that the government is responsible for a safer society. It was a recurring theme. I'm sure we've all seen Don't Look Up. If somebody's not seen it, do watch it. I think many of us will be able to relate with it. So some of the lessons that I've learned in the wake of COVID and what I've experienced otherwise, that we need to be thoughtful. What Dr. Priyadarsh said, that in our responses to a disaster, that we don't contribute to inequity or injustice. Because often our efforts are, sort of right in response. There's no time for too much planning. But as we move ahead, we need to become mature in our responses, work for the long term, strengthen neglected systems, address the slow disasters that are affecting people. In terms of COVID, we over-medicalized a public health and a social problem. When we talk of disasters, it is a political issue. We need to strengthen democratic institutions. By that, I mean, how responsive is the government to the needs of its citizens? The more the power, the more the onus of responsibility. And we do need to reflect and learn in the aftermath of a disaster. So in some countries in the West, there are sort of activities happening to reflect and even hold governments accountable, I think in Canada and in other countries, on what transpired during COVID. Conflicts are inevitable when people are working together in a sudden crisis situation. So volunteers and communities working together need to keep that in mind from beforehand and hopefully preempt some of those issues. I think I'll stop here in the interest of time. Thank you.
Thank you, Sonali, for that great presentation. It's the community doesn't end at volunteering, and the role goes way beyond that, and which is, I feel, a much more difficult role to hold somebody accountable for what happened. But like you mentioned, we have this slow disaster ongoing, which you showed a picture of 2 patients on 1 bed. And this is something which happened recently in Odisha, where the hospitals couldn't take the burden of the patients who were coming in. And that was leading to a lot of poor quality of care being given. So I'll just hand it over to Dr. Gina now to talk about how should a hospital prepare itself to face a disaster. Over to you.
Good evening, I'm Dr. Gina, and thank you, Parth, for this opportunity. I'll just share screen. So I'm going to discuss disaster management and the role of healthcare centers. So when we think of a disaster, I guess what plays through our mind is chaos, noise, inability to handle the numbers, a lot of ambulances, and it all reflects back in our hospital system. So what is it that we can do to make it much more streamlined? What is it that we can do to make it better for the people itself? And how is it that we can do more for them rather than harm? How can we prepare and be ready for a disaster from the hospital's point of view? So there are a lot of things, there are a lot of protocols made. Each government has its own disaster management plan. There are Western guidelines, Indian guidelines. Actually, I looked through many of them, but how much of it is followed? How much of it is actually taking place? And a large component of response to a disaster from a hospital's point of view is preparedness. If we aren't prepared, it's very difficult to respond. So the importance of risk assessment, communication planning, training, policies, procedures, and preparedness towards it has to be emphasized from the beginning. So from a hospital point of view, a way to divide the preparedness is the initial pre-disaster phase, the disaster phase, and then the post-disaster phase. It is a continuum. From one to the other we go. So in the pre-disaster phase, the main thing is planning, as I've already mentioned. What do we plan? So it's very important that the hospital has a disaster management committee. It's good to have a central command center. There has to be a coordination between hospitals in the area. All areas should have an interactive hospital coordination. So that should be done by the disaster management committee and the command centers itself. There has to be a surge capacity for beds. The fact that beds should be able to multiply as and when a disaster is happening. So that surge has to be available. The surge personnel, medical and non-medical, have to be there planned and kept so that when a disaster happens, they will be ready to come forward. Planning of security, very, very important in a disaster because there is a lot of chaos. COVID was a very good example. We used to stand in front at triage. There were patients begging for beds. And without the help of the security, it was very difficult to handle patients and relatives who were very emotional at that point. And we needed to, maintain a calm to actually do efficient work. So the security systems in an emergency situation are very, very important. Logistic planning must be there. Communication is something that none of us are trained adequately in. So teaching the teams involved in disaster management communication pre-hand, before it happens, so that they know how it is that we must communicate with the people who are there at the disaster site, with relatives, with government, with each other, between hospitals. That communication platform and teaching has to happen beforehand. Planning for transportation is something, again, which is a big problem. So we experienced, actually our biggest experience in these hospitals currently, recently, at least in Vellore, is with COVID. Transportation from where they are sick to the hospital, from hospital to hospital, our ambulance systems were overwhelmed. The financial situation with transport, so many things were a very big problem. So the transport systems have to be sorted out and a plan has to be made beforehand. So when COVID happened, we realized that there was going to be a dire straits with respect to PPE, oxygen. So there were a lot of things which were kept as stores. So when you know a disaster is going to happen, or with respect to the area, the disasters which are possible, disaster assessment and storing of requirements beforehand is very, very important. Financial planning, again, the patient, the added costs and everything that has to be done for the disaster help is very, very important. So there are hospitals and systems which have a disaster manual, but that won't do. It's very important that we conduct suitable drills. So in our hospital, we have drills for mass casualty because that's what we see very often, a trauma with multiple people injured at the same time. So there's a team which comes in, there's a social worker who's ready, there's a public resource person who's there to make sure everybody's all right. So that drill runs regularly so that when it actually happens, we're ready. But quite often what we forget to do is practice communication. That's one thing which we have to work on. And that is also very important. Continual staff education. Each time new people come in, they have to be educated towards how to handle a disaster. So that's very important. Now, once the preparedness is there and that protocol is kept in place, we look at how we handle the disaster. What is the response that we have to the disaster itself? So there's this initial pre-hospital care where teams are sent to the site where they must go and triage. So triage is very, very important. They look at the severity of the sickness of the person there or severity of the problem that has to be addressed. And they triage them into red, yellow, green, black. That's a system which is already created. Now, one thing which is lacking is their distribution from there. So we do whatever we can at site. Then there are lots of places internationally, the paramedic group handles this. But there's a big dearth in India with respect to that paramedic group. Now, once they are triaged or the initial first aid is done at the site, now where are they sent? So if you look at many places, even in the Orissa floods, even in COVID, all the patients run off to the tertiary care center or to a particular hospital. There is no coordination as to which hospital they go to. There is no triaging to hospitals. So if we could manage that, the sickest go to the tertiary care centers, the ones who need some amount of observation and care can go to smaller hospitals, and patients who just require hospices or just observation can be managed at small centers. That would debulk the load on the larger hospitals. So this initial at-site care and triage and then transportation to the required place is very, very important. And if done efficiently, will probably prevent the crowding in the main hospitals. So this is just showing how, in COVID, there were places which were created to keep people who just needed to be observed, but still not enough because our hospitals were just overcrowded. And not just COVID, in Urea floods and all that, there was just an overcrowding. If it was relocated, the patients were sent to correct places, then probably this could have been prevented. I've taken this protocol from the Kerala government protocolization for disaster, and I thought it was a beautifully written protocol where as soon as a disaster happens, the commanding center is activated, and that command center does all the allocation. So the labs, the blood bank, the pharmacy, the ICUs, the staff allocation, personnel, social workers, the PR, they're all activated by the command center. And that's very, very important because the doctors and the people who are working on the floor will not have time to do it. So the command center takes charge of that activation and mobilization of people. Then the triage from ED and allocation of jobs in the different areas where help is needed for that particular disaster. Now, once the patient comes to you, there is division into emergency, stable, observation, and to the mortuary based on how bad the disease process is. The way it is done has to be practiced, and usually a hospital is equipped to do this type of triage. This is actually a photo of my emergency department. If you see the second photo, there are days when it is really, really crowded. So that triage system is very, very important. It's the first nurse-run triage in Southeast Asia. Our nurses have been taught to classify patients based on how sick they are. And based on how sick they are, they get immediate care. So the ones who are really bad get care immediately. And those who can wait a little can wait, and then they are addressed so that every patient gets their treatment in time. Within the hospital, there are certain things which are very, very important. So manpower distribution. If there is an emergency, the people have to be reallocated from elective services to a place where the emergency is happening, so that the elective services actually may take a back seat till the emergency has been bypassed or it's over. Role allocations, each person's role. So in COVID, there were a group of doctors who went to the emergency, a group of doctors for ward care, a group of doctors in ICU, a group of people just for communication, people to just be there when a patient requires support because they don't even have relatives in the hospital. So the role allocation at that point is very, very important. Resources were used and are used during an emergency, or continuous feedback to see how much more we require is very important so that resources are continue to be maintained. Hospitals have to prioritize what they can do, and patients can be shifted to other centers if there is need from hospital to hospital. So inter-hospital communication also is very important. Again, my stress on communication. So communication in this stressful situation to the patient, to the relative, to the government, between doctors. There are times, not just doctors, between health personnel. There are times when there is so much frustration and sadness that interpersonal communication just takes a backbench. So all that actually training and requirement and a lot of counseling actually is needed during a disaster situation. CMC's COVID story, I just want to stress on that because it was one real disaster. When the news came out of what was happening, it was a distant reality and we really never thought it'll come to our doorstep. But when it actually came, there were days when we all sat in a room and stitched masks because we didn't know what PPE was going to be available in our hospital. There were people who got sick very early in their time, so we had to keep them isolated for 28 days, and our hospital had to manage with the staff which was available. So CMC actually had a very good command center. So where we got information when patients were coming in, we had command center would allocate beds for the patients. Command center will keep an idea of who are the doctors who are actually sick. So when you're exposed to a COVID patient, you get information the next day, and then the isolation, everything took place just automatically. So the whole COVID story was a good example of how a lot of organization was done. There was some lack, but there was things which were lacking, but we did step up and do as much as we could in such a large disaster. If you notice in this picture, this is our oxygen storage which we had prepared towards COVID, and how different doctors were and different people were allocated roles in the entire COVID story. Now, the disaster response takes a toll on all the people who participate. Then after that, the next phase is reconstruction, recuperation, restoration. And that is also very, very important because disasters come again and again and again. So the hospital and the pre-hospital services have to reconstruct. So first debrief, change what can be changed, rebuild systems, recuperate. It is a continuum. There's a continuum between the capacity development, the incident, rehabilitation, reconstruction, and being ready for the next disaster. And from each disaster, we learn what can be changed, what is the next step, what more can be done, so that next time we're better ready, and next time we do better when there's a disaster at our doorstep. So this continuum is a holistic process, and that has to be maintained, and everybody has to participate in it. So hopefully through this, and if we all work together, we can be more prepared for our next disaster. Thank you.
Thank you so much, ma'am, for that. Again, another lovely presentation. I remember I worked in emergency for a year, and those random drills, you will get just an alarm that there's mass casualty activated, mock drills. But you'll have to rush and go, and then you will reach and you'll realize, it's just a mock drill. But it was my second last day in emergency, and actually a mass casualty was activated when I was there. So those mock drills really helped to, again, be prepared. So thank you for sharing that wonderful model. But ultimately, it comes down to how do we make a larger impact? And that's where the government steps in, because at individual level we can only do so much, at volunteer level, community level, or even hospital level, a hospital as big as CMC. But ultimately, it's the government that has to do something. So now I'll now hand it over to Dr. Ramesh to tell us about what the government should do or can do better or is doing well. Over to you, sir.
Oh, thank you. Thanks, Parth, for inviting me. And I want to congratulate all the speakers who had been very eloquently outlined details. And I just got back from UK after 3 weeks, and I really don't have a presentation. So I'll just share my random thoughts, and I hope they would be useful. I mean, I can see myself, so I think it's a bit scaring me. So let me change my settings. Yeah, I mean, ultimately everything boils down to government, because governments exist to protect the citizens and to ensure that there's not just a short-term response, but there is also a long-time resilience that is built in mitigating, preventing, and also responding effectively to crisis. And actually, my own career had been, in a way, had been at the center of disasters. I spent 10 years of my initial field work working in the Naxal-affected districts of Andhra Pradesh, almost Andhra Pradesh. Those days it was Telangana, Andhra Pradesh. So my entire field career had been in the midst of serious crisis in a way. Then my international career, which I spent 13 years working across the world, had been again all across crisis areas. I mean, mostly man-made, from Mindanao in Philippines, East Timor, Myanmar, Northern Laos, Jaffna, Northeast India, Bangladesh, Afghanistan. I spent a substantial time, Somalia, Sudan, Iraq, Palestine. So it's so what I've learned, and I headed for a little while, for a year or so, the unit that for formulating programs in this disaster related areas, mostly man-made disasters. But disaster is a disaster, whether it's man-made or otherwise. And last 6-7 years that I had been in the government again, is government of Andhra Pradesh, I've seen the Hudhud cyclone, and then the disaster of gas leak in Vizag, where the LG chemicals, and then COVID itself. So let me just put this all experience in a sort of a presentable framework that is comprehensible. Number one is long-term mitigation. There is nothing like long-term mitigation. I mean, that includes building resilience, building preventive measures, preparing for disasters. I think India, in my younger days, we had actually a lot more robust system for responding to disasters. There was a disaster plan which was decentralized. Every village had a plan of action. Not always, I mean, where I always felt which was missing was in terms of the missing community link. And I think that is quite well highlighted by Sonali, and also the link to hospitals was quite outlined by Dr. Gina. But I think what really struck me as always important is how meticulously governments prepared, at least in Andhra Pradesh, the plan to meet, not so much to prevent or mitigate, but to provide immediate response. So people were fairly well trained. I seen that somehow in several states, this system has fallen by the wayside. Now, this system really was what we inherited from the British, which really had village-based, habitation-based type of a disaster response system. Now, in 2005, as you know, we had this disaster management legislation, which is central legislation. And then 2009, 2010, that we set up the central disaster management system, and then state level, and then the district level disaster systems. Now, there are policies, there are plans to address the disasters. But what happens is when the disaster breaks, one is never really prepared. So a lot depends on 2-3 things. Number one is the leadership. Number two is the capacity to coordinate the various agencies, how you pull them together. The third is how well trained the staff are, because you're required to draw upon multiple departments and multiple agencies and at different levels. And so this effectively, again, goes back to communication, feedback, response, resources, and how well the resources are deployed where they are most needed. And I think has been said, what really happens is the poorest, the weakest, and the children, the women, they are the worst sufferers in any disasters anywhere. And the remote, the villages, the most inaccessible, get the least attention because it's really no communication gets received from there. So people are left to fend for themselves. In a way, you see a lot more cohesive communities in situations in where the government is least present, which is paradoxical, but that is the reality of the situation, because the people ultimately know they have to hang themselves together in order to protect themselves. And so obviously there is a cost to disaster response, and the governments have a system by which the government, the district collectors, and they can in turn delegate this authority to draw upon as much money as they need. So usually in the disaster situations, the financial resources are not a serious constraint. They could be a constraint, but they are not a serious constraint. The Treasury rules authorize the district collector to empower, to delegate any official to draw upon the resources. But where really the challenges is because the disaster comes and it comes as a flood or a cyclone. Your communications are lost, your logistics system is gone asunder. Some of the staff who are supposed to provide this relief themselves are impacted, their families are affected. So there is a huge human angle, which sometimes we tend to forget. I mean, how do you expect if my home itself is washed away and my children are impacted, my family is impacted? How do I really care for others? So this is these are some of the important issues, and most important in my view has been highlighted is the community's own participation, their own preparedness. And I've seen, the biggest disaster perhaps I witnessed myself was the September 11th in New York City. And I was working in the center of city those days. And the way it's not just the government that responded, but the neighborhood committees, the volunteers. And I'm very glad that Dr. Priyadarsh has talked about volunteerism. And there's much more how well the volunteers are organized and prepared to work in a coordinated context. I think it becomes very critical. Now, what I have seen in our own country is that when there is a disaster, there are people from various non-governmental organizations, NGOs, international agencies, they all pouring together and without any coordinated mechanism. I think that is another big challenge, really. How do you bring them all together and direct them to where they are required? Or one is prepared in advance to really manage these additional resources that are not factored in while the plan is being formulated. Because there is a lot of critical inputs that keep coming in from whether the international agencies or from the non-governmental agencies or sheer volunteerism. I mean, it's really the time of crisis that the society comes up and says that, we are here to help others. And this sense of altruism, the sense of higher calling that is generally missing at the usual times that we get to see. The response being one, but what is really important is the relief, rehabilitation, reconstruction, and the longer term lessons. What do we learn? How do we mainstream this into the development is the biggest challenge. In fact, what I take away or what I've taken away from the COVID management is this lack of longer term appreciation of the challenges and mainstreaming the lessons that we have learned into building the resilience for the longer term. In fact, I feel very sad that so little lessons the government has learned from the COVID management. I mean, all the missteps that we've made, all the disasters that we have actually perpetuated, and all the difficulties and the crisis that the humanity is faced. And I think in a way, this also has to do with the lack of feedback loop, number one. Number two is the citizen participation. Number three is acknowledging and recognizing the reality. Because, I mean, it is easy to say that everything is hunky-dory, everything is going on fine, we are best prepared, we are better, we have done better than anyone else. And so in the process, forgetting the fact that several challenges had remained unaddressed, unacknowledged, and not acted upon. I think this becomes really the most important lesson that I continue to carry back is that how little we learned from the biggest crisis like COVID. And it was mostly treated as a central government's response. I mean, the lockdowns and the thereafter which was essentially, instead of really ultimately, if one looks at the entire response, particularly vaccination, it was the decentralized action that really that was most effective rather than the centralized action. So it's important to have command control structures, the coordinated mechanism, but I think it's very important to be alive to the minute, where you need to really alive and realign, continuously improvise on a continuous basis. And I have learned a lot myself, where I was leading the coordination response for COVID in the initial 3 to 4 months in Andhra Pradesh. And later, of course, I left that because things were not things were not going the way. But the fact is that the government has the first and the last responsibility for all disaster management. And that is why we have the governments, and particularly in democracy. And that's the real reason for the governments to exist. Now, what I have also seen in China is the way that every disaster is an opportunity for creating long-term sustainability, long-term community ownership, and long-term relationship building between the sort of formal institutional mechanism and the semi-formal, quasi-formal, non-formal, informal systems that exist in the reality at the various levels. So, I mean, I thank you once again. I hope that I've made some useful observations, but really governments have a lot more to learn. And some of these lessons really are de novo arising from what we are seeing all around us. Some lessons that we take away from each one of you who work in different areas, institutions, community, volunteerism, and then more importantly, also from the past mechanisms that existed. In fact, I've always been impressed with the way the British had sort of documented each of the disasters and how they have been managed and not managed, and what new lessons to be learned. This is something, again, I notice that is missing from the contemporary Indian government context. So I hope some of these issues get really addressed, and then people continue to learn. Thank you so much. Thanks for this opportunity.
Thanks a lot, sir. I personally learned a lot. I don't know that finances are not a barrier. That's something I've learned today. Because personally, I keep blaming that, we finance things less. And I thought that is what is impacting the government to not play a major role when the disaster comes in. And one theme which is accidentally coming out is communication and coordination. I think everybody has mentioned the same thing. And being prepared. So I think these are the three take-home messages that everybody has mentioned. I would request participants, if there's anything, they can raise their hand or type in the chat box if there's anything they want to personally ask. Till then, there's also a link that I posted, a Google form for feedback in the chat box. Please make sure you fill that as well. Sonali, anything that you want to share?
I'm just sharing all the links to all the things I talked about if somebody wants to explore further.
Yes, please go ahead, Sita.
Yeah, I'm Sita. I'm a senior psychiatrist. As a psychiatrist, every patient is a risk assessment for us. And that is where I start. So when Dr. Chandy talked about preparedness and prevention, I was very happy, because oftentimes I feel, as Mr. Ramesh said, in India, somehow risk assessment is not in the picture. Afterwards, we scramble and we say in hindsight, this should have been done, that should have been done. But I don't know, Dr. Vaid was talking about maintenance. How often, and any institution or even a public park where there is a giant wheel, how often do they spend time to look at maintenance? And is there a governing system and anything that looks at how has the maintenance been done? So to me, having worked overseas and as a psychiatrist where we were taught about preparedness and PTSD, for me, often it is a frustrating feeling seeing in India that we have somehow, we don't do risk assessment. In that regard, I'm glad Dr. Chandy brought up that Pentagon, and I was quite happy that she talked about all of that stuff. Yeah, and as Mr. Ramesh said, he worked in 9/11 the time, and I'm sure he would have seen how overseas system. I'm sounding like a very snobbish NRI, but it is a frustration that I feel when I'm here looking at the failures in our system. Thank you.
Thank you for your comments. I totally agree with you that that we have a long way to go, and that's this discussion what it's all about. For us to discuss where we are lacking, so that this sort of becomes a part of our conversation. So next time we meet somebody, we can say that I heard yesterday that this is what's happening in our disaster response or preparedness, and eventually with everybody talking about this, we can hold government responsible one day, I believe, I hope. So thank you for your comments. Anybody else wishes to say anything? You can unmute yourself, take off your camera, we can see you.
It would be nice to hear from the participants, and I'm sure they will have something to say. And
hi, Devi.
Hi, Parth, and thank you, Nivarna, once again for a really engaged conversation. I just had one question. It was great listening to all the speakers and so much to take away. Just one specifically to Dr. Chandy, that, I was thinking that when you're thinking through this, the protocol that you've put in place and the chart that you have and so on, as somebody who thinks about organization design a little bit, how do you ensure that one is to have this in place, but how do you ensure people comply and there is that coordination on the ground, right? I mean, as Parth was also saying, that you keep having these drills, so you anticipate that, okay, this is going to happen. So my question is, one, the compliance, but also that how do you ensure the organization coordinates with these different units, right, throughout? I realize this is quite a...
So there is role allocation. So each person, so as we run through the drills, each person is allocated a role so that it is very clear. Ambiguity adds to confusion. So when the roles are clear, then when you have to deal with it in real life, it is very clear. It's just white and black. This is what you're supposed to do.
Okay.
The part which is difficult is communication. I keep saying that because that's the one thing which is very difficult to practice. So there are ways to deal with that. There are certain things which we do to help with communication, but short of that, that is just what is going to happen on the floor. So when you have a mock drill, there is a person in charge. So there's a person who is supposed to supervise and make sure things are aligned or going the way it is supposed to go. In case they pick up that something is wrong, they're the ones who are supposed to troubleshoot. So in a mass casualty incident, like let's say a flood happens and or a accident happens and a large number of patients are brought to the ED, then that person in charge will be watching to see if everybody is aligned to their role, if communication is okay, if they are performing the way they need to, so as to optimize the treatment for all the people there. So that person in charge kind of makes sure things are okay, but the roles have been taught in advance so that there will be least ambiguity. But that's as much as which can be done. You must remember, it's in a lot of noise and chaos, so it is actually quite difficult.
Sure. No, thank you so much, and thanks again for the great work that all of you are doing. Thanks. Yeah.
Dr. Mesh, if you want to take up that question that is there in the chat box.
yes, I think Neha has said that how do you influence the government? Governments are not easy to be influenced because governments generally believe that they have all the answers for every problem. However, I think few ways that citizens really can, particularly experts and particularly those who have the expertise and knowledge. Number one is to write. Write directly and to the governments, and also giving your ideas, and also to through media. And both popular media, print media, social media, electronic media. I think Sonali does that very well, and some of you are actively engaged in that, and I think that's one way. The third is that I think it's really many of the practitioners themselves, or the policymakers, those who are really leading the policy, are themselves are not aware of these different dimensions. Because government somehow, when you're working in the government, you are 24/7 busy managing crisis, or you believe that you are busy, or they're certainly very busy because it's poorly organized. Your meetings go on endlessly. There are endless number of phone calls. There are thousands of people waiting to see you. So it is a 24/7 activity. Productivity may be very low, but the activity, of course, is 24/7. So this sort of a seminars, you could invite active commissioners of disaster management in the state, chief secretaries in charge of the coordination, and then bring them together and then challenge them with the different dimensions. I mean, the community issues, the financial issues, the resource issues, the volunteerism. How do they connect with the hospital centers, or So I think they learn a lot in the process. This sort of a roundtables, seminars, communication, this rarely happens. So in fact, I see very little learning that goes on even between the states. I mean, I know, for example, Kerala has a very good disaster management plan. So also is Odisha, is excellent. They have excellent experience actually in more effectively managing. They are constrained by resources. So there are ways of really bringing people together, because it's ultimately for the good. The weakest link I would like to leave you with this idea is between the government and the communities, and the government and the non-governmental entities and enterprises, where a lot of capacity, experience, expertise resides. And community for sure. I mean, I think that is Sonali's presentation. The thing that I take away is how do the communities memorialize and then learn and then carry forward some of these horrific human tragedies. And I think that's happening all the time. I mean, Odisha, the railway accident, the Balasore incident, I think is a very big example of not just for the railways, but for the overall management of a disaster. So I think I would like to carry that back.
Thank you, sir. If there are no further questions, if all the speakers want to just give one last word and what we can do or what they hope to see in the coming future when it comes to disaster management. Dr. Gina, if you want to start, 2 or 3 words max.
That's difficult. I was just thinking pre-hospital care is something we must do, because to get the patients to the hospital where they need help, if we can set up our pre-hospital care, we'll be in a better place.
Thank you. Sonali?
So I'm also going to speak on what Dr. Ramesh spoke. So some of us need to be really careful about black and white. So it's not that if you're critiquing the government, you can't work with the government. Wherever you can, wherever you find a link, latch on to the government. We wrote letters to Delhi government. They did respond, maybe not to the extent we wanted, but they responded. We were even given the authority to triage patients for the Delhi government ambulance when we said that, one, nurses need to be involved, and secondly, triage needs to improve. So they were okay with handing over that responsibility. At the same time, on Twitter, I was criticizing things, right? On the other hand, I was handling calls transferred to me through the government, right? So it's not black and white. Engage wherever possible, find responsive individuals. The government is not this nebulous entity. It's made up of human beings. Many do try to help and engage despite their limitations. That balance needs to be found. Community groups, NGOs, individuals, some of us who volunteer tend to have more of a critical stance towards government. We have to constantly figure out a middle way and challenge ourselves to keep doing that, because ultimately bigger stuff has to be done together with the government. So critique and cooperate simultaneously. And the other thing we didn't talk about is the role of media. We really, really need to support local journalism. This is outside of the discussion today, but when a disaster strikes, it is the local journalists, the local media outlets, the vernacular outlets, they are the ones who are going to report in the immediate aftermath. Otherwise, that information and news is going to be lost. That's another piece that is critical in the wake of a disaster. Excellent, learned a lot from everyone. Thank you very much.
Dr. Priyadarsh, any final words from you?
Because the disasters are not going to stop. They are going to keep on increasing, and in different areas where we didn't see in disasters. So more and more disasters are happening in more and more places. So in coming years, we'll see many more disasters. We have to be prepared. The youths and the volunteers have to be prepared. I'm just thinking about volunteers' perspective. So it has to be somewhat ingrained in the educational process, and the preparation can start from that, and also to how to observe, how to respond properly. So we have to give some models where we did a holistic response, and those models can be replicated elsewhere. So at least in one or two disasters, we have to show such models. That is one thing. And second thing we missed is about the priority to the people who are in really who are in the need, and also the sexual offenses specifically on females whenever the disaster happens, because there is a lot of sexual assaults, a lot of human trafficking and all those things. So that need to be taken care of. And the vulnerable population, how to cater the vulnerable population will be the key, along with the coordination.
Thank you, Dr. Priyadarsh. Any final words from you, Ramesh sir?
Oh, thanks, Parth, for the organizing this. I want to thank all my panelists and the attendees. I take away a number of messages from here, and I think Dr. Sita has said about the importance of how well organized one needs to be. I'm looking at particularly the Western experience, and I think there's a lot of lessons over there, and active citizen engagement with the government. Governments have to learn, citizens have to learn, and I think good message from Sonali about the how media, particularly media is all pervasive now. There are stringers even in the remote corners of the country. They can be a very good source of the right message if only they are encouraged to do so. Social media is a very powerful instrument as well. Communication, feedback to the government and the officials. And I think ultimately this slow disaster of poverty, inequality, and the gender dimension, these are issues I think which really needs to be brought up front and center stage. And they are not, these are invisible subterranean disasters, and they are with us all the time, and we seem to ignore them all the time, and to our own peril. We'll never build resilience, we'll never be able to prevent disasters as long as the slow brewing disasters are with us. So let's this group continue to stay engaged in some of these issues. Thank you so much.
Thanks a lot, sir. And thank you everybody for joining again Saturday evening. So thank you for taking out time to be a part of this discussion. We have continued with our tradition and gone beyond 1 hour, which was the planned time. We are almost reaching 1.5 hours. thank you all once again. There's something more coming up in the near future. Sonali and I'll be collaborating to start a series on stories of change, quality care in action. So we'll be sharing quality improvement in healthcare soon. I am committing socially to this so that Sonali and I can go ahead with it. There's also a forum coming up end of next month on palliative care. So I'll be sharing more information on that soon. Till then, please fill our feedback form. Any other feedback that you would like to give us, you can write to us using our website. Do check out our work on our website, www.navarna.org. And thank you once again for joining today. I feel this was one of the most complete forum discussions we have had so far. Thank you, everybody, and have a great weekend. Bye.